Sitting here in Fiji together with Andrew Jacobs and other colleagues, and in front of me I'm with Dr. Naidu, who runs a very impressive mobile clinic which we fund out of the European Instrument for Democracy and Human Rights. And we funded out of the Instrument for Democracy and Human Rights, giving the shockingly high level of gender-based problems still here in Fiji. And I was just given an interesting tour of the passionate work done by Dr. Naidu, and maybe you can explain a bit to colleagues back in Europe, best practices of that project and things you would like to share more broadly with our colleagues back home.
Okay. This project is based on basically strengthening rights of rural women by improving their access, knowledge and understanding of how to control their own reproduction. Because if a woman does not know how to control her reproduction, that is also very disempowering for them. So in Fiji, we have 40% of our population that are below the poverty line, and a lot of them are in rural areas. And what happens here is that even though girls go to primary school and high school and do just as well as boys, but after that they fall off the perch, you know, they kind of don't keep up. And I think reproduction and lack of awareness of what to do and how to control is a very important part of them being disempowered. We have a high teenage pregnancy rate, so every 1 in 10 delivery that happens is of a teenage mother, which is very high. And we have very high cervical cancer rates, we have high gender-based violence, we have high sexually transmitted infections in the young. So, and the awareness is very, very poor. And awareness is not just a superficial awareness only, but to know why they should be doing certain things is very, very poor. So the aim of this project is to go to the women, sit amongst them, spend a whole day with our health educators, with our health promotion officers, with our nurses. So it's a whole team where a few are in here, but the rest are out there where they're continually getting the education in these various areas. But at the bottom of it all is also understanding that reproductive health is also their basic right, not a luxury. For every woman, it is now recognized. I know if you know, the Cairo Convention in 1994 has said the reproductive health right is a basic right of every woman. And in that reproductive health is if they can't control their reproduction, that's completely disempowering. So based on all that, we are doing this project. So what we're doing is not just the outreach and not just the clinics. We are doing workshops. We're going to schools. We talk to students. We have women's advocates groups where we actually bringing women from different groups that we bring them all together and run workshops for them, give them material to take with them so that they can be our advocates in the community, because obviously we can't reach all the women, and they will be able to reach more of the women. So, and similarly with the youth, because our youth have high unemployment and, as I said, high other problems. So youth too, we do workshops with them. What is always very heartening, and I'm sure Diane and others will tell you, is that when we start a workshop or when we start a day, they're all very, you know, reserved and not wanting. But by the end of the day, this is middle of the day, you saw how they all start to open up. Because when I first bring up I have to be very careful how I come to the gender-based violence issue. I always skirt around everything else, and then I come and touch on that, and you know, I have to wait and see the response before how I go, and I have to be careful. So, but by the time as the day progresses, they start to open up and they start to talk, and they're telling us their issues, why certain things happen in a particular way, what are the inhibiting factors for them, and it's I think it's so wonderful to see as though the light suddenly starts to begin to shine in them, you know, like, as though, well, yes, it is, you know, it is our basic right not to get bashed around, and it is our basic right to be able to control our reproduction. So all that is what this is based on. And
excellent. Well, thank you very much, and also thank you for the nurses who accompany you here in the mobile clinic. We also have your volunteers joining in. I also hear that you abandoned your your hospital job.
Yes,
in order to be here.
yes.
So,
I abandoned a very nice job in Sydney to be here. Then I abandoned the job here to be out
Wow.
here. So,
anyway, well done. Continue the good work, and of course, I'm also pleased that we can give this some
yes,
support.
thank you.
Thank you.
Thank you.
Thank you.